Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about a revolutionary treatment that we've been using for years, several years now, for plantar fasciitis, Topaz Radiocoblation. This is a video that should have been done yesterday, but because of some of the graphics that I wanted to add, I decided I would wait till today where I had the resources to actually put these graphics on the screen with us so that we can actually talk about this for you. So first things first, a reminder, plantar fasciitis is an inflammation of the plantar fascia, which is the ligament on the bottom of the foot. So you have the heel, you have the Achilles tendon that attaches, plantar fascia that attaches on the bottom. The plantar fascia is pulling, gets inflamed, painful, and tender. I'm going to show you a graphic that kind of shows exactly what's happening as you injure this plantar fascia. So the idea is you have collagen bundles, you have flattened fibroblasts, and you have the capillaries, including some of the platelets and so forth. When you injure it, you interrupt the capillaries, which interrupts the blood flow, and because of it, you start to have death of the other tissues in the area. So you start to get basically the tissues start to shrink and go away, and so it becomes a pretty significant and chronic problem that continues to repeat over and over and over again. You improve it, it starts to heal, and then you re-injure it and it starts to go backwards again. So that's where we're starting. And so with the Topaz Radiocoblation, it's basically a surgical procedure that we actually do in a minimally invasive fashion. So let me kind of start that video as well, and we'll kind of show you what we're doing here. So with Topaz Radiocoblation, we're basically marking the areas of maximal tenderness. We'll actually evaluate you before in the preoperative area, and we'll actually mark all the areas that are painful because we want to treat this in such a way we typically will over-treat this as opposed to under-treat it. And the idea is we want to treat it so that we can actually get a resolution of the symptoms or an improvement of the symptoms in this area. So then what we do is we draw out a grid of basically pinholes over the areas of maximal tenderness. This is a small area. Typically now, after doing it for years, we actually do a larger area, and we use a wire driver to create little pinholes in those areas. We actually perforate the skin so that we can actually insert a wand. It's actually a radio frequency wand, or uses radio frequency waves to create mini tears in the plantar fascia. So we actually go through and we'll do it at a varying depths. The whole idea of this, the whole reason that we're doing this is to treat the injured area. So we're basically going in and creating little mini tears in the plantar fascia to allow it to lengthen. We're stimulating new blood vessel formation and growth factor migration to the area to really allow it to recover and heal. So here you can actually see we're actually inserting the wand, and we activate it, and using radio frequencies, it creates this activation. So it stimulates new blood vessel formation, growth factor migration, and create little mini tears in the plantar fascia. So I'll let you watch this for just 1 second here, and then we're going to actually switch to another graphic, which will allow you to see exactly what we're doing in a more graphical fashion in the ligament. And as you can see, we actually go through each of these holes, and we do it in such a way to make sure we do enough stimulation to that tissue to allow it to all recover and all heal. If we were to leave any of these areas untreated, then you'd have areas that still hurt. So basically, this is what we're doing. As you can see in this, we're not doing the exact same depth. We're doing varying depths because what we don't want to do is weaken this tissue in such a way that we create a higher risk of a tear, which actually can create a new form of injury or a new form of pain. So it's a pretty successful treatment, and the way that we will actually treat this after the fact. So you actually are going through this procedure here, and then what we do is we allow individuals to walk on this right off the bat, although they're in a post-op shoe, a protective shoe, for 2 days. Then they're in normal shoes, normal activities after just 2 days. So as far as surgeries are concerned, this is very, very rare, and the recovery and the return to normal activities is amazingly quick. So, and let me kind of show you one more graphic. We will take this off. One more graphic that will actually show you exactly what's happening. It increases blood growth factors. It causes neoangiogenesis, or new blood vessel formation. And because of this, it causes a regrowth of the collagen fibers and a repair of this tissue. So it's a very effective treatment. We're getting amazing results with it. And I do recommend this as a surgical treatment for plantar fasciitis, although we don't usually start there. If you've gone through a lot of treatments, you're going through a lot of things saying nothing is working. This is significantly more effective than the other treatments that were previously used for plantar fasciitis. I'm Dr. Brandt Gibson, and this is your Podiatry Tips Day 228. And the idea is Topaz Radiocoblation is a revolutionary treatment to surgically treat and correct plantar fasciitis, and I do recommend it in individuals that have tried many of the other treatments. Thank you, and have a great rest of your day.